Today we're going to talk about the thyroid hormone profile. We think it's important for us to give you information on what it is that we're looking for so that we can understand how these hormones are made and what implication the different levels have on your health or our understanding of your health. Now, of course, the thyroid gland is a little butterfly-shaped gland lying in the throat area right here. But the thyroid gland, although it makes the thyroid hormone, it's instructed on what to do by higher centers up in the brain. So we have a center in the brain called the thalamus. The thalamus controls the hypothalamus controls the pituitary gland, and so there's information that comes from the brain to get the whole thyroid pathway going. And there's feedback that goes to all of these different levels, and that affects how your body makes the thyroid hormone. The hypothalamus tells the pituitary to make the thyroid hormone by making a hormone called thyrotropin-releasing hormone. And the pituitary tells the thyroid gland to make thyroid hormone by releasing a hormone called TSH, or thyroid-stimulating hormone. All of these hormones are produced in pulsatile fashion. So if you were to measure them throughout the day, you'd find that they're never exactly the same hour by hour. Now, what is it exactly that the thyroid gland produces? Well, the thyroid gland makes a couple of different hormones. What is necessary in the thyroid gland to make the thyroid hormone is three main ingredients. We need tyrosine. It's an amino acid, and I'll write that with a TY. We need a mineral called iodine. Iodine, iodine, iodide. I'm going to write it as an I negative. And then we need a particular enzyme called TPO. And I'm going to put that as TPO here. And TPO couples the iodines together so that they can be put onto the tyrosine, and that's what the thyroid hormone is. So there's two main thyroid hormones that are created by the thyroid gland that get out into our system, T4 and T3. Basically, T4 is a tyrosine with 4 iodines attached to it. T3 is a tyrosine with 3 iodines attached to it. So when the thyroid gland produces these hormones, 93% of what it pumps out is T4. The T3 is only about 7% of what is pumped out from the thyroid gland. T3 is actually the more active hormone. T4 is a very weak hormone. And our body has to convert the T4 into the T3 for it to become a more active hormone and do its job. And thyroid hormone is very important because the thyroid hormone makes our metabolism go. And it also gets into the cells and tells the DNA inside of every cell of your body to get to work and do its job. So without thyroid hormone, the cells in your body couldn't do their job. Every cell in the body depends on it. So how does the thyroid hormone actually get into the cells? When the thyroid hormone is released from the thyroid gland, there's a protein in the bloodstream called thyroid binding globulin that picks it up. I'm going to draw it here for you like a little truck. Thyroid binding globulin collects the T4 and the T3 and carries it through the bloodstream. Now, T4 and T3 will bind to the thyroid binding globulin, but there's always a little T4 and a little bit of T3 that doesn't bind. It's free. It floats loosely in the blood. And that's what we call free T4 and free T3. I'll write that as an FT4 and FT3. And likely you have had one or the other of those hormones measured when your doctor has done your TSH level. Now, when free T4 and free T3 get out of the bloodstream and go into a cell, here's my cell. I'm going to draw it in red. And what I want to show you here is that they don't do their work on the outside of the cell. They go in and they go all the way to the nucleus of the cell where the DNA is. And that's where the receptor is. And that's where they tell the cell that it's time to work. And then the DNA does its job making proteins and doing whatever job that cell is. So if you're a nerve cell, you're going to conduct nerve impulses. If you're a heart cell, you're going to contract. If you're a bone cell, you're going to go grow and make bone tissue. So all of the cells in the body require the thyroid hormone. Remember once again that the T3 is the stronger hormone, T4 is a weak hormone. Now, remember when I said 93% of the hormone that we make is actually T4? But our body has the ability to convert the T4 into T3 out in the tissues. The main tissue where this happens is actually the liver, and it also happens in the muscle and in the gut as well. So 60% of the conversion of T4 into T3 happens in the liver. That's my picture of the liver right there. 60% happens when you have an enzyme called 5'-deiodinase that takes one iodine off and turns the T4 into T3. Okay? So there's our T3, and once it's made in the liver, it climbs onto our little transporter and away it goes off to the cells. Okay? We have another enzyme called 5-deiodinase, and this one's important. Many people don't talk about this one, but we think it's quite important. It converts the T4 into reverse T3. So if you were to look at the T4 molecule and say, well, if I took this one off, I'd have T3, but if I take this one off, I get reverse T3. The difference is this: regular T3 puts the gas pedal down, runs the metabolism, turns up the energy. Reverse T3 binds up to the receptor, but it actually acts like a brake. So your body has this dynamic ability to negotiate like a NASCAR driver, gas pedal, brake pedal. And how does your body decide whether to put down one pedal or the other? It's how the body decides, is there enough gas in the gas tank for us to put down the gas pedal, or should we be putting down the brake pedal? And what lowers the gas in your gas tank? Fatigue, exhaustion, toxins, lack of nutrition. All the things that we're addressing in our program affect this entire system. Inflammation is another one that will affect the system. So now 10 to 20% of our T4 is converted into reverse T3, 20% at the maximum. There's still another 20%, and this other 20% is converted in the gut. There's a picture of a piece of bowel. The T4, I'm going to just draw 20% here, of T4 goes into the gut, and then cells in the gut will do chemical changes with it, acylation, sulfation, and turn it into T3 so that the T3 can get off and go into the bloodstream and go to the cells. Gut health is very important for this conversion. What does it take? It takes a very good microbiome. We've spent a lot of time talking about that and working on that with you, because without a good healthy gut, we won't be able to do that particular process. Now, one other thing that I want to point out to you in this whole cascade is that there are some things that we have to have in the system that make these pathways work. For example, we need things like iron and selenium, and there's some neurotransmitters as well. Neurotransmitters that allow this to happen, specifically serotonin and dopamine. So when we have a patient whose serotonin is very low, the dopamine's very low, they're having maybe emotional issues that go with that, it's not a hard stretch to figure that maybe their thyroid hormones aren't being produced as well as they should be. What I want to mention to you is that there are some things that can shut the whole system down, or at least impact the system negatively. One of those things is cortisol. If cortisol levels go up, then that can decrease the activity in the entire pathway. Where does cortisol come from? It comes from stress. So if stress is high, that can decrease all of the activity in the whole pathway. And the other thing that can as well is inflammation. And inflammation can be from a number of different things, but if we suspect inflammation and we see that the thyroid pathways are not functioning normally, then that can be a cause. Now, there's one other thing that could also be a cause of problems, and that's antibodies or autoimmune thyroid disease. Sometimes the body will develop antibodies against tissues inside of our own body. It happens because of an unhealthy gut. We call that a leaky gut. It's a situation where the barrier in the gut can't be nice and tight, and so proteins leak into the bloodstream, and the body may develop antibodies to these proteins and then mistake the antibody against the protein for another tissue. And it's very common for the body to make antibodies against thyroid-related tissues. One of the antibodies is TPO antibody. Another one is thyroglobulin, which is a protein right inside of the thyroid gland. So sometimes we'll actually measure for these antibodies and look and see what those levels are so that we can help you to understand if part of the issue with your thyroid is that it's being attacked by your immune system. Now I want to talk to you just for a moment about the thyroid hormone levels that we do. When patients come in to see us, we usually like to take a look at a full thyroid picture so that we have an idea of where we're starting. When we do follow-up lab tests, we may not do the full picture, but we at least need a full picture at baseline. That would include the TSH, and all of you are pretty much used to getting a TSH level done, a total T4 and T3, and the free T4 and T3. We also look at the reverse T3, so we have an idea as to whether or not that brake pedal is being put down. And then we tend to look at your thyroid antibodies as well. Thyroid stimulating hormone should tell your thyroid gland to make the hormone. If your TSH, this one, is going up, it's because your thyroid is not making the hormone. If your TSH is too low, it's usually because there's too much thyroid hormone. So we have to look at all of that and bring the whole picture together. The final thing that's important in all of this is how these other factors come into play. The other micronutrients that your body needs that can change whether or not these pathways work. And so we'll be addressing all of those things with you when we're talking to you about your nutrition.